Okay, Dr. Morey with the more uncivilized anatomy, just these little quick anatomy tidbits. And today we're going to talk about movement terms you probably hear all the time. And I'm going to try to give you the basics so you know how they work. If you watch our other video, we talk about the planes of division, planes of dissection, frontal plane, sometimes called the coronal plane, sagittal plane, and the transverse or horizontal plane. Now these planes, for instance, I was talking about the coronal plane or frontal plane being like a big guillotine blade that drops right through me and cuts me into a front and a back half. That big plane of glass or that guillotine blade. That guillotine blade would move or rotate around an axis. Okay, and in that case, it's going to be the z-axis. If you remember these, x, y, and z from x, y coordinates from graphs and plotting and math or something. And then you have the z-axis, so the x is going to run the horizontal, and the y will be up and down, then z would be coming sort of right at the camera. So those three dimensions, we can plot something in space. Now, think of these as axes around which the plane will rotate. So the z-axis, which is pointing straight out, is the one that the frontal plane would rotate around. The y-axis that goes straight up and down would be the one that the horizontal plane would rotate around. And then the x-axis, which goes, in my case, from right to left, would be the one that the sagittal plane would spin or rotate around. Okay? So keeping that in mind, we have a few pair in red and blue. I showed you on the axes where these are spinning around, and you can kind of pause this and go back and look at it later. We have a couple primary pairs of motion around these. The first pair is going to be flexion extension, so that happens in the sagittal plane around the x-axis. So for instance, when I flex my shoulders forward, I'm bringing them forward in the sagittal plane, and when I extend my shoulders, I'm extending to the rear in the sagittal plane. There are other sort of tidbits and definitional cues you can use, like using the anterior surface of the long bone and the angle made at the joint. So a more acute or decreasing angle is flexion, and a more open angle is extension. But try to think of it more in these planes and around these axes, then maybe that'll help you out. Flexion extension, so I'm flexing my elbow, so the angle at my elbow between my forearm and my arm is getting smaller, and then as I open that angle up, as it gets closer out to 180, that's more of an extension. Interestingly enough, in the lower body, since my flexors are on the opposite side, when I flex my knees and elbows together, they're actually going in different directions, but both still operating in that sagittal plane around that x-axis. All right, we move to the horizontal plane. We're going to talk about rotations, medial and lateral rotation. So this will happen in that horizontal plane, and I'm going to flex my elbow to 90 degrees so that you can see a little easier as I medially rotate my humerus, my arm, at my shoulder. Okay, so I medially rotate. Another cue, cue would be the anterior surface turns to face the midline, and then an external rotation would be the anterior surface moving or facing away from the midline. So that would be external or lateral rotation. People say internal, external rotation, medial, lateral is probably better, but they're both there, so you can refer to those. Okay. We get to the frontal plane around the z-axis. We're going to have abduction and adduction. So sometimes I say abduction and adduction, just because in the Midwest sometimes abduction and adduction sound the same. So in this case, I'm moving in the frontal plane. We'll still work my arm at my shoulder. When I abduct or abduct, I'm taking that limb further away from the midline in the frontal plane. And when I adduct and bring it back toward the midline or the medial, the midplane, sorry, the mid-sagittal line in that frontal plane, I'm adducting. So abduction and adduction. When you get to something like the hand, because some of the fingers are moving away from the midline and some are moving toward the midline, so that's not a good definition. So we use the middle finger as the center that the fingers abduct away from and adduct toward. My middle finger doesn't move. Same thing with your toes, that second toe, right, when we get down to the foot. That'll come into play in a minute with the secondary set of movement terms in these different planes. So in the sagittal plane, again, moving forward and backward, the sagittal plane that is going to spin around that x-axis. Instead of spinning, changing angles of joints like flexion extension, we're going to be sliding in the plane with the protraction and retraction. So a good example of this is my jaw. If I slide my jaw forward and back, I'm protracting and retracting. I can make this motion with my head. I can protract and retract. Really, that's flexion of neck vertebra. We'll talk about that later. So sliding forward in that plane and sliding back would be a protraction and retraction. We get down to the horizontal plane again. We're going to talk about pronation and supination. This is, again, I'm in the anatomic plane, but I'm spinning still in that horizontal plane. Okay? I'm spinning in that horizontal plane just like the long bone of my arm at the shoulder is turning internally and externally, or medial and lateral. The palm of my hand, as I pronate, is going to turn in that horizontal plane to pronate, palm down, or supinate, palm up or palm forward. Okay? Another good way to see this is if you look right at your middle finger. When I supinate, my palm is facing up. When I pronate, my hand will rotate around my middle finger from supination to pronation. Okay? But again, we reference everything in the anatomic position. So I'm pronating and supinating my forearm, my hand at the forearm. My forearm is actually doing the motion. My hand and wrist are just attached to the end, and they rotate around the axis of that third digit, my middle finger. When we get down to the frontal plane, the secondary set will be elevation and depression. So this again is not spinning around, but sort of sliding up and down that frontal plane. And a good example here is my shoulder blades. When I elevate and depress my shoulder blades. Elevate, moving superiorly, and depress, moving inferiorly. I can elevate and depress my eyebrows, right, up and down. They're sliding in that frontal plane. Now there's a couple other terms. Circumduction. This is sort of related to the rotations. Okay? In this case, I would take my arm all the way through a motion around an axis that's pinned through my glenohumeral joint, and I just swing that whole arm around in circumduction. Another example of invert and evert, or a good example of invert and evert, will be down at my foot. So we're talking about your calcaneus, okay, which is this heel bone. Right? So I'm in the frontal plane, and if it swings to face in, so the bottom surface of that calcaneus is facing in, I've inverted my ankle, and if I turn that to face out, I've everted my ankle. So inversion, eversion. That happens at the ankle. The midfoot, you can pronate and supinate just like the palm, but we'll talk about that in another one. So those are the basic pairs. You have some primary turning elements in each of those three planes around their corresponding axes, and then you have some that slide, protract, retract, elevate, depress, and a couple more special circumstances of turning around the axes with pronation, supination. Then you have circumduction, inversion, and eversion at the foot and ankle. So these are some of the basic movement terms. Try to think of them, you can come up with all sorts of shortcuts to remember them, but think of them as they work with the axes and the planes of division we used anatomically in the other video, and then you'll get the hang of this real quick and be able to describe all the human movements in proper anatomic terms. All right, don't forget to like and subscribe to the video.